Welcome back to the Better Health Now podcast. Today I have the opportunity to sit down with Stefania Aquite, a nurse practitioner, and Meg Morrow, a nurse in the Bariatric Surgery program here at Cullman Regional. Thank you so much for joining me today.
Thank you.
Thank you. We're excited to be here.
Yeah. So before we kind of dive into weight loss surgery that y'all work hand in hand with here at Cullman Regional, talk a little bit about your journey to get here to Cullman and kind of how long you've been here.
Go first. So I have been at Cullman for 9 years. Originally, I started as a floor nurse, did that for the past 6-7 years. Then I've been a nurse practitioner here for 2 years, and it's like working with family.
I've been a nurse for 21 years. I started here at Cullman Regional in the surgery department as an OR circulator, and I've transitioned into this in the last couple of years.
Awesome. So weight loss surgery as a whole is not maybe the right solution for everyone. Talk a little bit about what the factors that you maybe see a patient with that maybe makes them a better candidate for a successful weight loss surgery.
So a lot of the times we'll need patients that have, a high BMI, say 35, that have diabetes, high blood pressure, sleep apnea, heart disease. And these are patients that have had, medication in the past to help lose weight, diets in the past that have tried to lose weight. Sometimes their metabolism doesn't allow them. So these are patients that have a high BMI that have tried and failed diets, exercise, medicine. And those are the ones that we will, try to help with surgery.
And this program itself is a pretty long and extensive program, variety of different sort of levels of the process, from the consultation itself to screening appointments and nutritional counseling.
Mm-hmm.
Talk a little bit about how long this process it takes from a patient coming in and they're a good factor to then them beginning this program.
So it is a 6-month program. They are often referred to me by their primary care provider. At the initial visit with me, I kind of go over, it is a 6-month program. You'll be seeing me 3 times during the 6-month program. I'll refer you to a dietitian and to the surgeon, and then they will see the dietitian every month. They'll also be referred to psychiatry. They'll be referred to cardiology. They'll be referred to pulmonology as well. And also I will keep up with, what have you tried as far as dieting in the past. We kind of go over all of that at the initial visit. And then Meg is also responsible for seeing them with that initial visit with the surgeon.
Yeah. So talk a little bit about your role too, Meg, in that initial consultation, and then kind of what your role is throughout this journey.
Yeah. So the initial consultation, we just give them all the information that they're going to need about the bariatric surgeries themselves. They're going to have an option between 2. So at that point, they would choose which one is going to work best for them. Then throughout the process, I'm just trying to be there to answer questions for them. So whatever questions they may have, I'm there for them. A good thing is I will be a familiar face to them on surgery day because I'm in the operating room with them. I come pick them up and take them to surgery. And then hopefully after the procedure, they will continue to see me in support groups along the way. So we do those quarterly, and we hope for all the patients to come and get that support they need.
As far as the 6-month journey for a patient, it's a long drawn out process. So you're probably working with patients that are in different stages. How is there a variety of patients you're working with at a time that are in a variety of different stages, or is it typically 1 or 2 patients at a time?
Oh, absolutely. I have patients that are finishing the program, this week, and then some that I'm just seeing for the very first time. And then there are, once they have the surgery, I don't see them afterwards except for like out and about in the community. And I'm so excited when they stop me and say, hey, I've had surgery. I feel great. I'm doing great. I'm so excited I made this decision. So that I do see patients in those stages all the time.
Yeah. And Meg, talk a little bit about that day of surgery and the patient comes in. What does that experience look like for the patient and kind of that procedure as a whole?
Okay. So the day of surgery is pretty much like anybody that's going to have surgery. However, like I said, they will get to see me that day. You'll come in, get your IV started, talk to anesthesia, find out what kind of anesthesia you're going to require. They get to see the surgeon for the last time at that point. And then I come pick them up and take them to surgery. They will spend a little bit of time in a recovery room. Then they will have an overnight stay, usually one night, but it can be more than that. So we always tell people to prepare for that, but usually a one-night stay.
And I mean, there's probably different sort of metrics throughout this journey that a patient has to hit as far as maybe nutritional levels or whatever it might be. How much is or in the roles that y'all have and you play in this process, how often are you kind of measuring those numbers and making sure that they're hitting the benchmarks that they need to?
So again, I see them every 2 months. That's when I start to say, what are we doing? What have we changed?
Mm,
Are we meeting those benchmarks? And again, the bariatric surgeries, we got a whole team working alongside these patients. So they're also meeting with the dietitian every month to make sure that they are hitting these benchmarks, that they're, making those dietary modifications and, cheering them on as they do, because we
mm,
know it's hard. We know that this is a lifestyle that they're changing. So we are meeting with them from the dietitian's point of view, monthly. From my point of view, every 2 months.
mm. And I mean, this process as a whole is 6 months. What does that post sort of that journey look like for the patient? In surgery goes great, everything's good. They're a part of the support groups. Is there a moment in the journey for the patient that they kind of experience the full benefits of what that surgery did for them?
You can pretty much expect within the first 6 to 8 months, that's going to be your maximum weight loss
Mm,
time. Um, Part of what they learn, of course, with the dietitian is those weekly to monthly changes in their diet. So they will be on a clear liquid diet for a couple of weeks, and then
mm,
they progress throughout. They have to follow those rules, as we call them. You have to do that to get the optimization of your weight
mm.
loss.
And I mean, you mentioned a little bit about some of the post-op stuff with the support groups that
Hmm.
are part of it. Is there a ability for patients that maybe go through this journey for added support if needed? And what is kind of that best sort of plan of action if someone says, hey, I need more than just the quarterly or whatever it might be, support groups?
Well, I'm there to answer questions. We also have some liaisons, meaning some patients that have done really well in the program that are willing to reach out to some of the patients. So there is that option.
Mm,
Like I said, we can I can talk to them on the phone and be any kind of sounding board for them to ask me
mm,
any questions. If they're not getting the maximum weight loss that they want, we do refer them back to the dietitian. Maybe it's something they're doing and they don't realize they're doing it.
mm.
And we need to get them back on track. So
Yeah.
that's where we go for support.
Yeah. So as you've been a part of many of these surgeries and you've seen kind of this journey for patients, is there a a preconceived idea or something that people maybe come in and they think this is going to be a certain way, but maybe they don't. It's not necessarily that way, that you kind of want to inform people that maybe are listening or watching that, hey, it actually looks like this.
Absolutely. We see patients that think this is an easy fix. It's not. It's a
Mm,
surgical procedure. You are changing the way your gastrointestinal system works. So
mhm,
you've got to, like I said, follow the rules that we have in place. It's not easy. It requires diet, exercise. We still want you to exercise
mm.
and to maintain the nutritional things that we give you.
And so, as the podcast is called Better Health Now,
Mhm.
this surgery and this journey for the patients is helping them have a better health and kind of seeing the benefits from it. How do you hope this will continue to impact Cullman Regional as a whole moving forward into 2025, and kind of what it could look like for the community at large?
So hopefully, with the bariatric surgery, our goal is that they will not have these long-term chronic conditions that they have, like diabetes. Maybe not completely get rid of these issues, but kind of remission some of them,
Mm,
kind of you know what I'm trying to say?
Yeah.
Yeah, like the chronic conditions will be easier to manage for them. We won't have to have so many medications. They
mm,
will feel better. They'll feel healthier. They'll want to
mm,
exercise. They won't have so many joint issues.
And sometimes it does resolve the issues. There is the gastric bypass for patients that have diabetes. If they've just had diabetes in the last 5 years, been diagnosed, it can actually cure them the day of
wow.
surgery. So because it's the way the insulin enters your body, so it's really
Yeah.
beneficial for those patients. Most of our patients come off of at least one of their high blood pressure medications within the first 6 months. So there is some great benefits of this surgery other than just weight loss.
Mm. Well, I appreciate you taking the last little bit talking about the surgery and the kind of the program that patients can experience. I mean, it's a long drawn out process, but it seems as though the roles in which you play in this is to help the patient understand everything,
Yeah.
make sure they're aware of what's going on, and then know how to continue moving forward post surgery. We'll be sure to have everything in the episode notes for more information if someone's interested. But thank you so much for joining me today.
Yeah, thank you.
Thank you for
Appreciate
having
it.
us.